So for today, I am going to demonstrate the total parenteral nutrition. So first is review physician's orders and compare to MAR and content label on TPN solution bag and for rate of infusion. Each component of the TPN solution must be verified with the physician's orders. Next is collect supplies. We have here the TPN solution, syringe, IV tubing, and sterile gloves. So first is prepare the TPN solution by shaking the sanitize your hand. And now we are going to open the IV tubing and we will sanitize it. First is we will sanitize the tip or the cup of the TPN bag and also the spike of the IV tubing, so it will remain sterile. And after that, that's when we prime IV tubing with filter as per agency protocol. TPN requires special IV tubing with a filter. Now we are going to put it on its place and start priming. Ensure tubing is primed correctly to prevent air embolism. An air embolism occurs when a gas bubble enters a vein or artery. It can block the passage of blood. Now perform hand hygiene. Hand hygiene prevents the spread of microorganisms. Then identify yourself to the patient and also identify patients using two patients identifiers. Ask their complete name and their birth date. Compare the MAR to the patient's wristband. This is the proper identification, prevents patient's error. And then after that, it's explain the procedure to the patient. That the goal of the treatment is to correct or prevent malnutrition. Next is complete all safety checks for CBC as per agency policy. This adheres to safety policies related to central line care. So I'm doing the sterile gloving, but you can also use a clean gloves. If changing TPN solution, pause EID and remove all TPN administration set. We will disinfect connection and change IV tubing as per agency policy. But in my case, I will start TPN for the first time. And we are going to flush it using 10 cc syringe and disinfect CBC lumens as per agency policy. The purpose of this is to strict aseptic technique with IV changes as patients with high dextrose solution are at greater risk of developing infection. And next is we will insert new TPN solution and IV tubing into EID. EID must be used with all TPN administration. And next we will start TPN infusion rate as physician's orders. It is to prevent medication errors. And after the procedure, we will discard all supplies as per agency protocol and perform hand hygiene. These steps prevent all the spread of microorganisms. And after that is monitor for signs and symptoms of complication related to TPN. Complete daily assessments and monitoring for patients on TPN as per agency policy. And also flow rate may be monitored hourly. Be sure that there is no air and document the procedure in the patient chart as per agency policy. Note time when TPN bag is hung, number of bags and rate of infusion, assessment of CBC site and verification of patency, status of dressing, vital signs and weight, client tolerance of TPN, client response to therapy and understanding obstructions. And after that, tell the patient that you will come back and don't hesitate to say anything if she experiences any pain or can see any swelling or discomfort. That's all and thank you.